Good evening. Let me set this phone ringer off here just for a second. I should have done that one ago and I didn't. Appreciate everyone being here with us today. I have several people here to speak with you today, and I'll go ahead and give you the latest updates on our numbers. Georgia today has 4,638 confirmed cases. That's up from 3,817 yesterday. It's about 828 in 24 hours. We have one in Dade. Walker now has 2. Catoosa has 4. Chattooga 3. Whitfield County has 10. Floyd has 60. Gordon has 18. Bartow at 144. We have 139 deaths. That's up from 108 yesterday. Hamilton County, Tennessee, they have 2,239 confirmed cases. It's up from 1,834. That's 405 in 24 hours. We have 50 in Hamilton County with 3 deaths, 5 in Marion, 4 in Grundy County, 1 in Squatchy, 1 in Meigs, 10 in Bradley, and statewide they have 23 deaths. In Jackson County, they still have 8 confirmed cases, DeKalb 4, and they have 23 deaths statewide. Numbers keep climbing. Had to have several things here to actually touch on. We have a lot of people that have showed concern, these small businesses and people that are unemployed, and we've mentioned the unemployment. As far as you can go on our website. Kerry has that posted as far as what you need to do and what you need to know about filing. Also, there's a tremendous amount of money. We just left a meeting, or actually a conference call coming down from the federal government to help businesses and small businesses. Even if you're a small business and say you're self-employed, there's a lot of things out there right now, and I think Alex will probably touch on a little bit of that, but that really they're just now bringing down. So that's good news for people. We've had a lot of people that are self-employed that have asked about that. On the Cloudland Canyon issue out on the mountain, Robin, like I said, he's been working on this, and we've got some things together, and I think we've got a plan that we're going to actually. I've talked one-on-one with my commissioners over the phone, and it seems like everyone's is for this. We'll know tomorrow night. We will have our meeting tomorrow night, but we're going to issue actually a resolution or a plea to the governor to close the park, and we will sign that. All commissioners will sign it. I don't think that he will do that. I was on the phone with him yesterday for probably half an hour or so. But if he doesn't, we've researched this. Went back since last week, and we do have that road going into the canyon is County Road number 78. So it is a Dade County road, and we have a right to control that road for the health and welfare of our county. So if that doesn't work out pertaining to the park, then we'll get with our sheriff's department. Ray and I'll go out, and Tommy will look it over, and we'll probably go ahead and control that road as far as letting only our local traffic go in and out. And so during an emergency, we have the right to do that. And there's some other things that we're probably next week, by the week, end of the week, that we're going to probably implement. Robin's drawing these things up. We have an ordinance or so pertaining to out-of-state traffic on county roads. Now, that's one reason that we can't just go out there and shut down Cloudland Canyon. That is owned by the state of Georgia. It's controlled by the state of Georgia. And the governor, in too many ways, told me yesterday, we do not have a right to close it. And that's from the state. That's straight from his. That's not on the email. That's talking to him. So, and that's the way it is on on our state roads. Now we can police our county roads, and we can actually, when we do this ordinance, we'll be able to, or if we do it, because like I said, the commission's going to be behind me on this, or we won't do that. But we'll be able to actually any out-of-state cars that we see. Be able to question those cars, those people, find out if they're actually from a shelter-in-place county or a shelter-in-place state. And if that's the case, then we can tell them to go home. You know, that we really, until this is over with, they need to stay home, because that is an order, a law in their state that is passed. So, you know, I didn't think it would come to this, you know, but this thing's not getting any better. We're probably not even halfway through it. It's supposed to peak possibly around the 25th of this month. That's a prediction, you know, from our federal and our state people. But who knows if it will or if it will not. So we're going, you know, we're having to get serious with this in our county and protect our people here. Now we can't, of course, you know, like I said, we've got an interstate highway, which is kind of unique from a lot of counties in the state of Georgia. They don't have an interstate highway. You know, they've got maybe a 4-lane, but this is a federal highway. So, you know, as far as, you know, people keep saying, we'll close the county down. Well, we're kind of unique where we're at here, because we are, but we're bordering 2 different states, and we have an interstate highway here too. So that would be really hard to do without a tremendous without a tremendous workforce and law enforcement. But we feel we can handle it. We're doing the best we can, and we feel the commission, we're doing what we think is right for this county. Let's see. Carrie wanted me to remind you about today is Census Day, and you can go online and fill out your census. And we've had people ask us why that we're not a shelter-in-place county as of now, but we are. You know, we really, in a way, are, because, you know, you're supposed to be, you know, social distancing, foregoing discretionary travel, visiting with family and friends. You know, this is any groups. It's just going to take, you know, it's going to take all of us doing what's right, whether we actually pass the shelter in place or not. And I wouldn't doubt that would happen later on. But you know, that's a good question to ask, because we've got 39 states. I think a while ago we looked it up. Maybe 40 states now that have passed the shelter in place, and one of the ones that just did that today is Florida. So let me see here. Okay, I just want to touch on the meeting tomorrow night. That's because some people say, well, why are you having a commission meeting? Well, by law we have to. If it lasts 2 minutes, if it lasts 2 hours, we have to have these meetings, and that's why, you know, I always watch the clock. You know, if we set the time, and it's supposed to start at 6 o'clock or 7 o'clock, I wait till exactly that hour, because that's the law. That's something we have to do, and plus we need to get this out of the way anyway. I want my commissioners to look at this, and because it's a big deal, you know, what we're fixing to do here, and I want everyone to understand. My commissioners, you know, what's going on. We'll limit this meeting to 10 people in this room. The commissioners will be 6 foot apart. Everyone in here, our news people, will be 6 foot apart. It will not be a lengthy meeting, because we're going to handle just the actual most of the important stuff that's on our agenda, and then we're going to adjourn. So it's not like a normal meeting, you know. But the public can come, and if we have room for one, we'll let them in. If not, you can stand out in the hall 6 foot apart. All right, here, and you can watch and hear the meeting. But, you know, that's up to you, because it is an open to public meeting by law. Okay, let me move on. Josh Engel, he's here representing our schools. We also have Alex, of course, and we have our health department here today. And who else we got today? We got Tommy, you want? I'm sure he'll think of something here in a minute. So he's here with us, Tommy Bradford. So, Josh, you want to come on up? We'll go with you there.
Thank you, Mr. Rumley. Good afternoon. Just want to update you on the meals. Today we served 8,544 meals. That's equivalent to 1 lunch and 1 breakfast for 3 days, which brings our total to 37,168. That's 37,168 since the school closure. Just a reminder that next week we'll be on spring break, so there will be no meals and no digital learning. So I hope and pray that we are blessed with a week of great weather. While we're on break, Martha Baker, our Dade County Family Connections Coordinator, and Kristen Barrett, the Dade County Schools social worker, They have organized a curbside pickup at Dade County High School. The dates of that will be April the 6th and April the 8th. And pickup times will be from 3 p.m. to 6 p.m. So it'll be a lot like our meal drive-through now, except it'll only be at Dade County High School on the 6th and the 8th from 3 p.m. to 6 p.m. And one final thing, the principals recently sent out a survey seeking input from parents about the digital learning and the stress. We feel the stress even when we're in the office, and we know that you all feel the stress as well. But if you will take time to complete that survey, I know that Mr. Farney sent his out through a text message. I think Ms. Beeler, the new middle school principal, she's posted hers on the website and social media, and Ms. Blevins emailed hers out as well. It's very similar to a survey that the Davis parents took a week or so ago. So if you'll just take a few moments and fill that out, that'll give us an opportunity to review some of that feedback and kind of come up with a plan and regroup when we debrief as administrators. So that's all I have. Thank you, Mr. Rumley.
Hi, I'm Tammy Franklin from the Health Department. I wanted to address two issues. We do look at the comments after these videos, and a couple of things. One thing came up yesterday, and then Carrie said, people just keep asking also about recovery rates. So I've looked for recovery rates, and the only place I really found anything was on the Johns Hopkins website. They list the worldwide cases, deaths, and recovery. And if you look on there and figure out percentage, it's still about 80% that are recovering from this. But those numbers, you have to still think about also, there's a lot of people at home, they're not getting tested, that probably have this, that are recovering. So those numbers probably are not as accurate as they could be if everyone's getting tested. So, but still 80%. People are recovering, from this. And also yesterday, after we mentioned that there was a case in Dade County, several people wanted to know why we couldn't share the name of the person. And HIPAA laws, every time we go to the doctor, and everybody should be doing this, once a year you sign a paper that tells the doctor who they can share your health information with. And this was a law that was enacted in 1996. You have to give permission, to share your health information. So, that's just something, there will never be names shared because of that. We could get in trouble. And it's a federal law. We could get in a lot of trouble. So, and it wouldn't change what we're asking you to do. Whether you knew who this was or you didn't, we still want you to stay home. We want you to keep 6 feet between you and other people. We want you to cover your cough, wash your hands, everything we've told you over and over. None of that's going to change. So, we like your comments, and we hope to address some of them, but I just hope that kind of covered some that you've had. Thank you.
Good afternoon. I'm Alex Case, Director of Dade County Emergency Services and the Mayor. And I had a comment, as Tammy mentioned, that a lot of us come up to this desk, but we do clean it. We do clean it after everything, and I'm going to clean it right now. And this is something that, is hard for us to get a hold of, and we're making things, but sanitation wipes and Clorox wipes and these type of medical grade wipes that we get is a shortage, and we're only limited so much in some of the things that we have asked for in our strategic stockpile. Luckily, we had a lot of this stuff. We've been able to get a lot of sanitizer in. Dr. Harris gave me and Ted an A+, and when I got up here and talked about our teamwork, there's a huge team behind each and every one of us. My 911 dispatchers, these folks are 24/7, 365. They are answering these hard questions on every medical call that we have now due to certain types of calls that we're getting dispatched to are also mimicking signs. So we're asking, do you have a fever? Are they hot to the touch? Are they chilling? Some of the 3 things of a fever. Are they got a persistent cough or persistent wheezing or sneezing because of our sneezing and those molecules that blow out into the air. And I think the EMS workers and the first responders and the fire departments that have to go out and help with these folks, they're protecting themselves, their clothing with the mask, the goggles, the gloves, and the gowns. And the gowns are something that we are limited with, and we dictate what we're going to use once we get there. But for sure, goggles, gloves, and mask is every call. So again, a very small part of a big picture. These folks that are out here daily are our ambulances, the county-owned ambulance and Puckett's ambulances. We disinfect them every call, every day, 24/7, but we are deeper cleaning as of we are now. And with potential cases of people that meet that criteria, that truck sometime goes out of service for 2 to 2.5 hours, as the truck it was a fogging system that Puckett has allowed us to use up at their headquarters in Chattanooga. Takes 20 minutes. Then these folks have got to come back and decon themselves, change clothes, wash clothes one at a time to get the truck back in service. So that is a major concern, as if we get over limited with calls and that truck's still in its decon mode, it's a concern, and we've got measures in place to help hold that with a reserve ambulance available in our volunteer group of Dade EMS if needed. We haven't got to that resource yet, or that situation yet, but it's a plan. And as Commissioner Rowland mentioned, we are on the rise from several prediction areas from starting today, April the 1st, and continuing on for the next 24 plus days. You're going to see a rise, and hopefully that can stay low in our area. I hope so. Again, it's us, the community, me and you and everybody. Please check on your family and friends, and if you know someone or you do feel those symptoms, please stay at home. Work through this stuff over the counter, like we are in a tremendous amount of season here for sinuses. So thank you, and we'll be back. And I guess any closing?
Yeah.
Oh, Tommy got something?
Do you want me to say something?
Here, I'll wipe
I
it
knew,
down
Tommy,
again.
I knew you would have
I'll
something.
say
like
something.
that.
Just,
Come on up here. Tommy,
So
bring
I
for
don't
the
feel
sheriff's
like
department.
anybody think that we're left out. So basically, we're still doing the same thing, answering our calls. The only thing that's different that you might see is we're not going to enter your home. We ask the officers to stay outside the home and keep their distance from you. Other than that, nothing's changed. We're just basically in the background and support for Ted, the EMA, and if we need to help Ted with the Cloudland Canyon issue or any other issues, we're here to do so. But other than that, that's basically it for us.
Well, Evan's going to say a few words to us here. Come on up, Evan.
Thank you, Commissioner. I just want to let everybody know that at 4 o'clock or right thereafter, Governor Kemp's going to be updating the situation in Georgia, and we intend to carry that on both radio and television via Chattanooga, or listening to the radio right now. It's going to be around 4 o'clock, and we intend to carry that live at 4 o'clock this afternoon.
Appreciate everyone being here today, as I said, and one of the reasons that we're actually, the commissioners are looking at doing this is Atlanta is a lot of people don't realize it is a hot spot now. In other words, it's like New York. They're comparing it to New York and also New Orleans, and so that's just right in line with us here. Get a lot of cars. There was a lot of Louisiana cars out there the other day at that park. And if we do this, the local travel, it's not going to really affect you at all. If you're going to the grocery store and all, it'll be mainly on our county roads. That if we feel that if the police officer feels that there is a need to actually question a person or whatever, because we just are trying to stop the actual spread of this virus, and try to keep it contained. The commissioners, I can't thank them enough. You don't see them here behind me. Robert came in and talked the other day. But let me tell you something. They're behind me 100%. I talk to these men every day. We communicate. Lamar's got a job. He's at work at hospital. Robert, he calls up more than he comes in now because he's staying in. he realizes, this is real, and he is staying in, he and his wife, and I just can't thank them all enough. Alan, he's in and out, and he stays at home too. We just bear with us on this, and we appreciate all the support we've had on this. It's just unreal, the people that's showing support for us here on this, because the governor. I had a guy tell me this morning, just call me, and he's one of the actual political people in Atlanta. He said, you should never override your governor. And we're not trying to override our governor. We no one knows what's best for Dade County than Dade County.
Better than us in Dade County.
Yeah, get a problem with that every once in a while. So anyway, Carrie is going to end this. No one knows what's best for Dade County better than Dade County's, and that's a fact. So bear with us.
That was exactly what I was going to talk about. Thank you guys so much for reaching out to us. I come with papers and telephone in hand the other night. Shortly after we received news of our first confirmed case, my telephone rang. I was at home, and telephone rang, and somebody said, "Do you know we have our first confirmed case?" I just saw that, and I said, "Yes, I do." He said, "Well, I'm sorry for calling you," and I'll just tell you, it was Officer Chad Payne. Chad, thank you for all you do for us. We appreciate you so much in the Sheriff's Department. And I told him, I said, don't ever apologize for calling, because this is going to take all of us. This is an all-hands-on-deck situation. We appreciate all the comments, all the questions, all the emails, all the texts, because that is how we are all staying informed. I did want to share with you, and I did put it in the comments, and Evan and I are working on getting the comments across the screen, the captioning, so you can see it as well. But I did put in our comments, and it will be on our website a little bit later today, the website for the Institute for Health Metrics. They're the company that is doing the metrics and the projections for when COVID-19 is going to peak in the United States. It's what the White House uses during their press briefings. So we are using that, and like Ted said, it is expected to peak between April 23rd and 26th in this area. And you'll see a lot of numbers that we share from Chattanooga, from Tennessee, from Georgia, because we are in this tri-state area, so it's not just Georgia. And I did want to show this to you. We share this every day, and today was the first day that there's not a zero confirmed case in our area. So I wanted to share that with you. Having said that, don't panic. Dade County is the same today as it was yesterday. Wash your hands, practice social distancing. And we had another person just a few moments ago say, so where was our confirmed case? Where have they been? Will you tell us all the places that person has been? And Tammy said this so well yesterday. She said, we kind of have to assume those people are moving freely throughout the community until they're sick. So act like it's everywhere, but don't be afraid. Use your common sense. Stay 6 feet apart from people. We will be carrying the governor's address on Facebook. We shared that last time, and I do want to reiterate that Evan Stone with KWIN will be sharing that as well. He will also be here to video our meeting tomorrow night, for which we are very thankful. Thank you, Evan, for doing that for us. And I did want to end with this. One of our watchers and listeners sent us another text saying there is a rumor going around that the National Guard is going to be deployed in our area. And so I sent to him in response a link to the website to FEMA, and they have on there a rumor. They have started an entire website just for rumor control, and it is updated constantly. So if you get something tomorrow saying that the National Guard is going to be deployed, go to that website. You can find it on our website, but go to that website, rumor control website through FEMA, that's FEMA, and look at that, because it is updated just very, very rapidly throughout the day, so you can trust that source. If you have a question about the source, feel free to call me. I'm going to give you my number if you want to grab a pencil. You can call me. I will check it out if you can't find it anywhere. But please make sure that your sources are verified before you share false information, because sharing false information can get people pretty scared pretty quickly. My telephone number is 423-290-6655. I'm going to say it again. You ready? It's 423-290-6655. Call me anytime. And I did want to close with this. The Census 2020, make it count. Go online today and fill this out. It's extremely important that you are counted as part of the population of Dade County. You've heard us talk a lot about the supplies, and Alex said earlier that we have limited supplies, and what we are sent is based off of the population of Dade County. It's not invasive. They're not going to ask for your blood type or anything like that. They just want to know how many people are living in your household. So make sure that you fill out your census so that we can count absolutely everyone in Dade County. Please share that from our Facebook page and our website, and remember to call and check on your friends and family, and we'll see you again tomorrow at 3 o'clock.